Hello and welcome to our town hall number 4. We're here to talk about what's new in school contact tracing in the state of Vermont. As you may know, we had some new guidance come out last week about this. And so we are so lucky to have Julia Pringle and Allison Lafferty returning for a second time to our town hall meetings to highlight what's new, to answer questions that may come up. Please stay muted. They do have a lot to share with us. If you have any questions, please put them into the chat box. Before we begin, I will just briefly say that we are in the works of a town hall for next Thursday on Test and Stay. So if you have any questions about that, please send them to COVID-19@vssna.org. And we can have our speakers address those questions next week. So without further ado, thank you, Julia and Allison, for coming, and I'm turning it over to you.
Thank you. We're really glad to be here, and thanks for inviting us. And today we are going to talk about what's new. So Julia, if you want to advance the slide for me. So today we hope to talk about, show you the materials and resources that we've updated. We want to tell you the updates to our contact tracing framework, which we hope will help you in your contact tracing efforts at school. We want to go over the no contact tracing plan for the 80% vaccination rate schools, but we will not be covering Test to Stay. As you just heard, you will stay tuned for more information on that later this week and next week from the AOE. So questions for that should be addressed to them. Okay. Next slide. So this is our testing guidance. You will find on our website, if you look on the testing page, it's our, oh, sorry, am I getting some feedback there? I apologize. There's a testing guide. So this will tell you what to do with every type of test. And if you read the directions up at the top, it'll tell you that the antigen test applies to whether it's home, in a doctor's office, whether you administered it yourself or your provider administered it. So it gives you all of that information. And we've even made an update since this one came out that just went out today. So look online today for the most recent one, but we think that this will be helpful. Like this obviously had no final steps, but some of the other, it's a 2-pager. So some of the other ones you'll notice, it tells you what to do. Is a follow-up PCR needed or not? Do I isolate or not? You know, what is needed next. And we hope that you will find this useful when you have a test reported to you from a family, that you'll know what to do with that. And it will also answer the questions of the home test, which I know you're getting frequently. Can we go on to the next slide? For reporting tests to us, to circle back to home tests again, there's been a lot of talk about home tests. And so what we did on our website was create a self-reporting tool. So by visiting this website, anyone can go online and report their self-test. There's some questions that they will ask. And if they say whether their test is positive or negative, some guidance will come up for them right away. So if it will say, if this test, let's say they put in negative, it will say, if you are symptomatic, please seek a PCR test. And it will give you links to the parts of our website that would help you find a test. Or if you say that you are positive, it will give you the link on isolation and notifying close contacts. This form gets directly uploaded into our system to notify us that there's been a positive test. So then we can reach out to the IP to gather information, and of course also reach out to you all if they were in school while infectious. So if you hear of families getting a home test, please send them to this site to report their results. So far, we've been getting good feedback that this is working well. So, you know, please share your experiences with families as well. Hopefully you'll find it helpful. Next slide. We also have updated our line list templates. And I know as nurses, you all are keeping line lists that you fill out. You guys do an amazing job about filling them out before you even make contact with us at some points. But we want you to know that our website, we have updated them. And that is because it links with our software that we use in order to track situations. So we are going to ask that you download this new form of the template, and please start using this one. It will help so much in getting all of those contacts into our system and making sure that everybody is accounted for in an efficient way. So please take note of that. That is an important change. Although the information you'll find has not changed that you're entering. It's just the technology behind the form itself so that it can be uploaded into our system. Okay.
Okay, so the other thing that has had some updates to it is the contact tracing framework. No major overhauls here. What we did was take a look at places where we could provide more clarity, particularly around like what does like having a seating chart do to determining close contacts, for example. So the image that I've posted here, like, you know, it just has a little more considerations for like a classroom with seating charts where like knowing exactly who's within 6 feet of people is really like easy versus a situation where that might not be feasible. So we've taken like this other lens and applied it to this chart just to try to make things a little bit more clear. So the actual criteria hasn't really changed very much, but take a look at it. We hope we've like headed off some frequently asked questions and made things a little bit more clear. And with that said, there is one area that we have changed a little bit. Recess situations were coming up quite a bit. And so we have developed a new tool that we're calling our possible low risk exposure notification letter. If you look at our recess contact tracing framework section, essentially what we're doing to approach recess, outdoor recess that is specifically, you know, if somebody is a clear close contact, they've been within 6 feet of the infectious person for 15 minutes or more, they're best buds, they hang out at recess, everybody knows. That's still a close contact and we'd recommend quarantine if they're unvaccinated. But we don't want to have to quarantine 3 classrooms who just happen to all be outside at the same time. So what we've introduced is, you know, this acknowledgement that there might be some possible low risk outdoor exposures. And instead of quarantining people, we're encouraging you to just provide a notification. So that section of this contact tracing framework has been a little bit updated. And now on our website, we do have this letter that you can send out. It's this low risk exposure letter. Essentially what it says is, hi, like you might have had low risk close contact with somebody. You know, we're not asking you to quarantine. We're asking you to have a really like low threshold for symptom monitoring and consider testing if you want. So that's a new tool. The other thing with recess and some other situations, you'll see that there's sometimes like an encouragement to conduct a risk assessment, get more information. This comes up in indoor recess situations sometimes, and other situations too. You'll see it referenced a couple times throughout the contact tracing framework. Essentially what that risk assessment is, you know, it's not necessarily like obvious right now just from the situation if this is like clear close contact or not. Like let's take a look at some other factors that are going to either decrease the risk or increase the risk. So we ask that you think through these different factors that are ongoing, and you know, if all of these factors are falling in this lower risk category, then you know, considering sending out the low risk quarantine or the low risk exposure letter is the approach, versus if things are higher risk, you might err on the side of you know, recommending stronger steps there. I just show you this because I know many of you are doing this before we get involved, but again, this is something that the health department can and should weigh in on jointly with you through the process. One other thing we just wanted to say, you know, we know that you are doing so much work on COVID-19 right now, and we are deeply grateful to all that you do. And you know your communities better than us, and some communities, it might be really important that you're calling people and you have the best judgment of that. If there is room and you need to streamline places, know that it is not like a requirement ask of us that you call people individually. Our ask is that at least this quarantine letter goes out to people who are close contacts. We really defer to your judgment about like the best way to do that, not only for your community, but also for your own sustainability. Know that like it is not our like need for you to make all of these individual phone calls, and we support you if a system like having robocalls to tell people to check their emails and sending the letter in an email makes more sense. We support you in that. The final thing we just wanted to touch on today was we have new guidance that schools that can attest that they have 80% or more of their student population fully vaccinated. There's not a need to contact trace anymore, which is great, and hopefully will reduce the burden in some schools very soon. What we wanted to do was just like provide a brief overview of what the ask is in these scenarios. So, we are going to continue calling positives. We'll learn that they attended school while infectious. We're still going to notify you. And so you'll know about the exposure. The ask is that, you think about what they participated in, and you at a very high level, not at this like, enumerating all close contacts, like no contact tracing ask. But think about who was exposed. So, it's a classroom. This group of people was exposed. We're asking that you notify them of their exposure. Just it doesn't have to be like every single person being called. You don't have to figure out who's a close contact. The ask is just notifying the exposed sectors. Hopefully like one email will suffice on that. The other ask is that you keep track of who was notified. That can be like this classroom, for example, or the soccer team or something of that nature. And then finally, like we know that there are some scenarios in which a positive person from an 80% school might be, sharing a bus ride with kids from another school, or playing in a hockey game indoors against kids from another school. If that scenario arises, again, like there's not a contact tracing ask, but we do ask that you notify those other schools of the exposure so that they can do contact tracing if they are not an 80% school. So, you're an 80% school, you have someone riding a bus with 2 elementary schools on there too. Let the elementary schools know about the exposure so they can take steps as they need to. So that was like a brief overview. Know that a couple things that we're working on right now. You're familiar with this checklist that we have on our website for what to do when there's a case. We're creating another one of those, which is just essentially what I walked through for 80% schools specifically. It'll be what to do if you're an 80% school and you have a case. Essentially like identify who was exposed, send the like low risk exposure notification letter, and notify other schools if people from other schools were exposed. And then like Allison said at the beginning, we know that there's going to be more information coming on Test to Stay. We don't have that today, but we will look forward to sharing more with you. And I know others will be sharing it as well. I think a lot will come from AOE on that front. So that's all we had. Pretty short presentation today. But I know there's a lot of moving parts right now. So if there's questions, we're happy to talk more in depth about any of those.
So one of the questions in the chat is about the line list, and that it was helpful in the old line list that things were highlighted that were most critical to include in the line list. And is that possible to do with this latest line list? Could you guys highlight it so that we fill out the most critical things?
That's a great question. I can talk to our data team about that. Short answer, I'm not sure. We have like automated some more software on our end. So like the back end technology is just such that it integrates like automatically with a couple of our systems. So whether or not that's a possibility is outside of my scope, but let me follow up on that. It sounds like it's helpful. So if it's a possibility, like I'd love to provide that. Do you know, Allison?
And just out of curiosity, are there many schools meeting the 80% vaccination rate at this time?
I
That
mean,
have gotten to that 80% mark?
it would be posted, the AOE, I believe, is going to be posting on their website, is our understanding, when they have a list. So we don't have knowledge of a list of schools. Just anecdotal knowledge is, I heard that from one school that they felt like they were there, but that's one school, so I don't have any concrete numbers to tell you, but it seems small. We've also heard from a mix of schools, some who are really excited about it and some who say, we're not going to implement this even if we reach that. Like, we don't want to implement this plan. So I think it's a mix. I think we got to wait and see. I think a lot of schools are just collecting their data right now. And so it's a little too early to say how many will meet that yet. But great question. We're also wondering ourselves.
So communication with the contact tracing team in general has been a challenge for us while we're contact tracing. Getting calls back is lengthy. I know that we tried to problem solve with the email address that you guys, your team had set up for us. But there still is a lag time there. And so we're just wondering, is there any other solutions that we might be able to come to together to have a shortened wait time to be talking? I mean, some schools wait a week before they hear back. Some schools, it's
Is
like a
that
whole
recent?
day.
Is it recent that it's been a week? Just curious.
I think that it's within the past week. I think it's gotten a little bit worse, to be honest. But
So
I'm just going based on what's in the chat and what I've heard
Totally.
nurses tell me.
No, thank you for that feedback. It's important. So I can tell you that one thing they're doing in the school teams is separating people out into groups so that you will have investigators assigned to like regions and school districts, so that it would be, you'd have more of a contact with, so it would be a consistent contact with the same person or small group of people. So they're moving to that system. They're putting the finishing touches on that system. So I think we're in hopes that that will also help, because then schools will know, like, hey, Allison and Julia are my people, so that's who I reach out to. So I think I'm hopeful that some of that, will help. There's also another great tool that we're working on that we couldn't present today because it's not up, but that I think will help a lot, which we're working on a web form. So when you get a case, you would fill it out and it would be PHI compliant. So you could fill out names, like students' names and everything, right on the chart, right online. And it would automatically load into a system for us, into a spreadsheet, so that we had access to it. So we could also see everything that was going on. So it wouldn't be like, oh, was it a phone call? Did somebody not get a phone call returned, not get an email returned, right? It would more automate it so that every time somebody did that report, it would be automatically entered there. So we could see who has this place been called today? Has this place been called today? So a little more of a checks and balance that could happen with a system like that. I know, Julia, you were just reviewing the form yesterday to have some more edits on it. Were you liking
It's really
the form?
cool. Yeah, and the goal there is to reduce the need for you to send an email and then have it responded to, that it would just be like a one and done, here's our report, and then it links to our assignment system right away for like a more timely thing, a more like trackable thing on our end, with like more easy like oversight of where everything is. So we hope to roll that out soon too. I should have added it to this coming soon slide. And then I think the other thing is, like, we are also in the process of onboarding and training a lot. And so I think we are trying to like build staff and capacity to like also meet the demand to do more timely and better. So we really appreciate your feedback on that.
Do you have any suggestions when we're in the midst of contact tracing and we need an immediate answer, but everyone's busy and there doesn't seem to be an answer coming back? Do you have any suggestions for us in that case scenario?
And this would be like determining like who's a close contact and like needing to make a big decision about whether you're sending like a classroom home or something like that.
Yeah, I think it's like when the school district really wants a weigh-in from the health department before they make this big decision. And it would feel more comfortable if the health department weighed in, but there's no one available for that immediate question.
So, I mean, Allison, interested in your thoughts too, but I think like as you are paired with like the people who are going to be your district contacts, like going to them in general, like we are probably going to have like a 24-hour period of time in which like, you know, it might not be possible to like have like feedback in 10 minutes. And so I think like, you know, if you haven't heard back and it's been like a 24-hour period of time, like email us and let us know that you haven't heard back, and we can also like escalate that, make sure it's being followed up on. So I think that's like a potential.
I agree.
I think there's some concern by some school nurses who have not received any department calls from the health department about positive COVID cases in their schools. And so is that because typically school nurses hear about it first, or there's just nothing in that region? Like, could you just try to, I think there's doubt that it's happening. So I'd like to like have you guys address, is it happening? And if it's not happening, why it may not be happening?
Is the question what that the school thinks they should have been notified of a case that they know of, but they weren't notified? Or you're saying they don't even
No,
know
it's
if a case existed, they just are surprised
correct.
there hasn't been one?
Yeah, they have not received any calls about any positive cases. Are you guys calling schools is the question.
The answer is yes, we are calling schools. And I think there's a lot of schools in the state who have not had cases yet. I mean, I would have to look up to quantify how many, but
Mhm.
I think there's a lot of schools who haven't had cases yet this year. Maybe a lot is
I can put the
maybe
data
not
table
quantifying it.
in the chart or in the chat.
Yeah, do you have the number of how many schools?
Let's see.
Like last week, it was like 80 schools, right? Had a case. So when you think of how many schools are in the or how many schools, and that's not districts, those were 80 individual school buildings.
So here's a link to
Right.
the school
So I
table.
think some of the concern is that that the school has found out about it first. So if the parent reports it to us as the school, the health department may not have called the school yet. So just remember that communication goes both ways. It's us to the health department and the health department to us.
Yeah, so we are calling all cases in the state and we are interviewing them to identify where they've been while infectious. And if we learn that someone was at school while infectious, we're notifying the school. I see someone like has asked in the chat, like, who are we notifying? Was it AOE that we worked with Allison to come up with that like contacts list? We have a big
Yes.
master database that has like, you know, typically 3 or 4 contacts per school. It's usually like the school nurse or the school COVID coordinator, the principal, whoever else was provided. And then we also have like contacts for all the superintendents. So our like protocol is to go through and exhaust first the contacts like at the school level, and then if we don't get a hold, to go up to the superintendent level. So that is like still like how things should be working, that we learn someone was in school and we notify you. That's still the plan. That's not going away. We don't notify you if somebody wasn't in school while infectious. And then, you know, I think to your point, Becca, like a lot of people, like, you know, this isn't unique to schools, but also places of work and stuff, it's not uncommon for you to find out a little bit before us. So all labs and providers are required to report to us within 24 hours, but case patients learn like right away of their result. And so it's not uncommon for somebody to learn of their positive status right away, reach out to the school, and then for later in the evening or overnight that come into our surveillance system. So it's common for you to know first, but we should know and still like contact you if you haven't reached out to us. But yes, like let's make it a two-way street. I think that this like online submission portal is going to help too. So if you learn before we reach out, like notify us. And if it's the other way around, like our plan is to still notify you.
So there's a request, multiple crests, for when you post something new, if you can put it in a different color on the website. Just a thought. And that may be not your area, maybe it's someone else that does that part, but if that would be helpful is what people are saying. And then I know that we have already addressed this in a town hall previously. Brina Holmes addressed this question, but is there any place on the website where someone could go for the information about someone being vaccinated, having tested, their symptoms go away, and they can return to school even without the result?
You're saying we have a vaccinated person who has developed COVID-like symptoms and they want to go to school while their test is pending.
If the symptoms resolve. So we asked this question to Brina Holmes in a previous town hall, and she said that if the person is vaccinated and they have developed symptoms, they go get a test. If the symptoms resolve completely before the test result comes back, then they can come back to school. Because it would be no different than an asymptomatic person who was a close contact coming to school if they were vaccinated.
I don't know if that's on our website.
I agree.
Yeah,
There's
happy
nothing
to like
on our website
chat with Brina about that.
We're asking if it can be added to the website so that when parents are saying, I want to send my kid back, he's vaccinated, he doesn't have any symptoms, why was he sitting at home waiting, that we can have a piece of information
we should check with
the Vermont
Brina,
Department of
because
Health website.
that is not typically the guidance we would provide is the issue. So let's check with Brina and see and get
Can you explain
clarification.
what your
Folks, can you guys
explain what your guidance
able
would
to hear
be?
me?
And please, whoever's speaking, please mute. Can you explain what your guidance would be from the epi standpoint in that case, and how it would differ from a close contact who's vaccinated but asymptomatic being able to come back to school?
Well, I think typically if somebody was symptomatic, we would ask them to get a test. And if they were symptomatic enough to get the test, we would wait for the test result before they would return. That is our normal, but I am not going to override anything Brina said. So it could be that we're missing something, which is why I said I'd rather discuss with Brina, because I certainly have no intent of overriding. I'm just telling you what our typical guidance is, but I think we should ask Brina for clarification.
Yeah, I'm here, guys.
Brina
Can you
is
hear
here.
me? That was me.
Yeah.
That was so sweet,
Sorry, go
Becca.
ahead,
You're like,
Brina.
if you're speaking, please mute. Shannon's right. I mean, this came up in the context of a very specific set of questions about people, clinical stuff. Like someone has a runny nose on Monday, they go ahead and get a test just out of an abundance of caution. There's some holdup with the test. It's now Thursday. They haven't had any symptoms since Monday. We were doing sort of a clinical that person's vaccinated, the symptoms were very brief, and they are completely well, and they shouldn't have to sit out and wait for the test results. We actually were asked that in the context of a teacher, not a student. So but it sounds like, Becca, it's continuing to come up in a way that it's frequent enough occurrence that someone's become well, but the test is still pending, which is kind of a bummer because it means our test turnaround is a little sluggish. And in that context, I hear Shannon that it's hard to standardize that advice on a website. We were talking more about the sort of, got well on Monday, now it's Thursday. It's definitely, vaccinated person. That doesn't sound like COVID. So I don't think we want to say it as a standard on a website because of the reason Shannon said. I mean, the easiest thing would be just get a test, get the results, right? So I'm back to the system issue rather than trying to make some workaround in that context.
So if someone I just want to have a clear message that we're giving ourselves as to what we tell a parent who said, my kid is vaccinated, they haven't had symptoms for 2 days, we're still awaiting a test result. We're supposed to say to the parent, you have to wait for the test result to come back. Is that correct?
This is Brina. I think that the epi team and the clinical folks should talk it through together. I think it's going to be too hard to standardize, Becca, but I hear you. I mean,
it's really an issue at the high school level, to be honest.
Yeah, no, I could see that with all those vaccinated kids, and they get a runny nose for a day and they're missing tons of school because the PCR is not back. I get it. But let's take that one offline for me and Shannon and Julia and Allison to talk about, maybe with Ben and Bill, and do a little bit go around. But you can see why it's an imperfect pathway either way, right? I mean, we're spending more and more time talking with our epi colleagues about communication. It's just so hard to standardize this because there could be some glitches here, right? Because if the resolution of symptoms is subjective and the test is pending, and but you guys have asked us enough that I know this must be happening a bunch. It's funny. I wish it wasn't. I wish you took a test, you got your results, you moved on.
So the next question is, are you tracking cases that are suspected in school transmission? A close contact that became positive while quarantining with no other exposure, but was not in school while infectious. Who would we report that to? It seems like important data.
I agree. That's part of what we do with your line lists. So one of the handy things about them, particularly in this new format, is that they interface automatically with all of our labs that come into the state. So we can automatically know if people who didn't attend school while infectious are part of an in-school transmission network. Part of the reason we do this is to monitor for outbreaks, which would be 3 or more epi-linked cases. And so we are looking for that. I agree, it's important. And yeah, thanks for the question.
Sorry, I'm reading the chat. Perhaps, so there's a suggestion in the chat about it might be helpful to have an algorithm for symptoms of illness in vaccinated people, similar to our PD algorithm, so that we would know what to tell people.
It's in the pediatric algorithm. I guess maybe you're talking about if you have staff or teachers with illness, but I mean, let us just take this back through because as you know, the algorithm requires careful attention and it's hard to answer quickly. But yes, we will attempt to address it. I'm going to just keep pushing that when someone has a PCR, we need our communities to get those tests back before the symptoms have resolved, right? Like that, because it's too,
Yeah.
I just find that's a difficult scenario.
I think we are seeing, just not necessarily with pediatrics, so Brina, maybe you could speak to that, but just in general, when vaccinated people are getting COVID, they are getting it symptoms when they do get symptoms, which isn't always, they are getting it for a much shorter duration typically. So it was like, oh, I started to, and that makes sense based on how the vaccination works, right? So I started to get sick for a couple of days, and then I feel better. And so even when they are testing positive, their illness, thankfully, is much more mild and very short-lived in the majority of them. So I don't know.
Yeah, the tricky part, this is why.
Kids.
Yeah, well, the hardest part about this, which I really love the conversation, is there's so many other respiratory viruses. So I think we're saying this person's not a close contact. They just develop a runny nose for a minute. So their likelihood that they've been exposed to COVID is really just based on community transmission and what's going on in their town, not that they've been identified as a close contact. So we're on a different pathway than a vaccinated person who's been in contact with someone with COVID that has a touch of a symptom. So definitely. I just know that Ben and Bill and Becca love talking to Julie and Allison and Shannon. So I'm gonna send an email right now, because they're gonna say there's 35 other respiratory viruses, and we still have to really count on our vaccine. It's that constant debate about these darn vaccines, because they're excellent, but they're not perfect. So that's what we'll discuss. Recognizing, of course, you guys as the school nurses are right in it every day, and it's hard when we can't come up with something simple on these calls. So I do apologize for that.
Can we go back to the first part of your presentation where you talked about the at-home test? Yes. And how parents can put that into the system? Yes. If someone has a positive rapid home test, is that considered final? Do they still need to get a PCR?
It's an antigen test. So as of right now, we count it as an antigen test. And according to the CDC, an antigen positive counts as a case. So we would stand up a response based on that. They can get a PCR, but it's not required. Antigen tests are particularly good in symptomatic people. I don't know who the audience was we were talking about this the other day with, but there's something like, we pulled some Vermont data, and there was something like 800 tests that we pulled. And of those who had an antigen positive, symptomatic individuals who had an antigen positive test and then had a follow-up PCR within 48 hours, which is the guideline, only 4% of those overturned the original antigen. So they're quite good when they're positive, and the person is symptomatic. They perform quite well. So I don't know if that gives you some reassurance with the antigen test, but it certainly, and that's Vermont data. So that's not even national data. That's just how it was performing here in Vermont.
The concern with them is more about a false negative than it is about a false positive, which is why we see in the guidance, like if you're symptomatic antigen negative, we're still recommending you get a follow-up PCR, because that's really where the concern is about false rates and antigen tests, which, as Allison said, include home tests.
So in the past, we would have to have a PCR confirmed positive case, which is no longer the case. You can have a positive antigen or a positive PCR to have a confirmed case in the school. So I think the question is, if we have a parent call about a positive antigen or rapid test, this is no longer considered a probable case, and now is a confirmed positive based on the new guidance. They want confirmation that, yes, this is a positive that we have to contact trace.
So I'm going to point you again to the testing chart that is on our website now that was in our presentation. I can put a link for that into the chat. We've hoped to like distill down all of these scenarios into like a digestible format because I know it comes up. So know that that's a resource for you. I can find that and put it in the chat. But also in short, like, you know, we have these different categories that we call cases, right? So like a confirmed case, there's this national, like a governing body, CSTE, and they come up with all these case definitions. And it's really like a surveillance tool. Like the way we categorize it, it doesn't necessarily always correlate to a difference in how we respond from a public health perspective. So we have this category called confirmed. If you're PCR positive, you're confirmed. But we have this other category, probable, and there's like a couple different ways that you can become a probable case. And one of them is just having a positive antigen test. If we have no other information, like you're just a probable case, and we actually respond to the situation in exactly the same way with that positive antigen as we would a confirmed case. So from like a contact tracing, like response standpoint, those two things like necessitate the same next steps. It just gets a little trickier with antigen tests because, you know, if someone happened to get a PCR test and it was negative, we would overturn it. So it's this weird category where like we are compelled to respond the same way we are with a confirmed case, but there's this like, oh, it could be overturned with a negative PCR because the confirmatory test would trump this probable test. But, you know, it's not required for us to act. But I think that that table, I hope, is going to like address all of these different combinations. And I'd encourage you to take a look at that.
I just posted it, Julia.
Oh, thank you.
So just to confirm, a negative antigen test with symptoms should stay out of school and get a PCR test before returning to school.
Yes.
Yes.
That was out of the chat, just so you know. How do we know that antigen positives will be reported? Do families know what steps to take if they're positive?
Test centers. So if it's done at a clinic or a healthcare provider, they are obligated to report all test results to us, antigen or PCR, within 24 hours. So they all know that. That's true of all tests. If they do an at-home test, that is what our communications department is working on, getting this communication out to tell people there is this way of reporting a home test, to try to let people know that they can report it through this mechanism to us. But an individual at home is not a mandated reporter the same way a healthcare facility is.
And as far as the OPR assigned person to each school district or each region, do you know what the time frame is to make sure that there's someone assigned to every district in the state by a certain day? Or
Sure, it's not going to be one person, like, so it's going to be, you know, like, for example, there might be this team that does Chittenden County and this team that does, you know, originally they were doing it by districts, district offices, like OLH district offices, but because some schools cross over those, they separated them out. So there will be a list which we can make available, but I think it's nearly finalized, with Shannon being away, one of our teammates having to be away yesterday and today. I would say next week. They were hoping to finalize it by Friday. It might be early next week now that they'll be looking to try to finalize it. So hopefully we'll get back to you on that.
and how will that be going out? Will that be going out through our school nurse liaisons to every school nurse?
Do you know how we're sending that out, Julia?
I don't, but we can figure that out.
Okay. It would be helpful to know so the nurses know where to look for that information, because that would be super helpful.
Okay, I just made a note of that so we can get back to you with that.
Thanks, Nate. Nate says he's happy to partner on a distributing list.
One of the questions is all the information that you've shared with us today embedded in the new guidance that came out last week?
Yes, I say with the exception of, well, a lot of things are on our website already. So like the new line list, it's on our website. There's a couple things that are coming soon. So like the 80 checklist for schools that meet the 80% vaccination threshold. That's not on our website yet. It's coming soon. The info about the antigen testing, like that table is live on our website. And Allison just put the link in the chat. I just dropped the link in the chat for the reporting tool. And we can also share these slides with like links to all of the resources after this. And that way it's just all going to be in one place. Here again is the testing link. So it's a mix. Some of these are already live on our website, and we just wanted to like point out that things have been updated. But we can share these slides too, so you have it.
I don't see any other burning questions in the chat. Oh, I do want to address Kara's question. This is not a question for Julie or Allison. And perhaps Caitlin or Nathan could jump on and answer this. But her question is there any movement allowing us school nurses to access the COVID vaccine data from the immunization registry? And unfortunately, the way the laws are written, we need the legislature to come back into active legislation, which doesn't happen until January, to change anything with the law. So until January, there will be no movement on this. We've really tried to brainstorm different ways. And Caitlin, I'm not sure if you want to chime in, but basically they've looked at every possible way to have this be an emergency session. There's no, I forget the wording. There's no previous like standard. I'm not a lawyer. I don't know what the surprise. I'm not a lawyer. But
hey, Becca, it's Brina.
Yeah.
I'll just say, I'm sure, I mean, Caitlin's in the chat too, that I would not say this issue is dead. I actually have been pretty impressed by people are still pushing.
Right.
And
I would
the
agree with that.
AAP,
And
yeah, the pediatricians are pushing too. So it's another example of great advocacy between VSSNA and the AAP. So hold on, I'm feeling hopeful.
And we are advocating for this, for them to come back for like an emergency legislative session. But there's no precedent. That's the word I was looking for. There's no other cases that have ever had that happen. And so we are planning on writing a letter to the legislature to advocate for an emergency session, but I don't want to hold anyone's hopes up that things will not be done before January, because Nathan and Caitlin and Elisa have really tried with the lawyers every angle how we could figure this out sooner. So that's that. Lindsay's asking if we can ask for parent permission to look at the registry. And unfortunately, Julia and Allison are not our registry experts. but
We
I
are
do
not,
not
but if-
believe, I do not
if-
believe so.
And if a parent was going to
Caitlin-
give you permission to do that, they would just tell you their vaccination status, I would think.
Exactly, which is
So-
the attestation form anyway. So right now, the state has said we need to do the attestation forms. I know you guys, I'm right in the same boat with you. Parents are not completing that. We are not getting anywhere near 80% return. And so there's no way we're going to be anywhere near 80% vaccination status. So it is a struggle. It is something that until we have reliable data, we're not going to have reliable numbers.
The one piece of good news is I know everyone at AOE is working on other options besides the 80% to keep kids in school. So there are other things, you know, like test and stay or whatever else coming down that, you know, provide other paths to keeping kids in school that we'll just have, you know, that we can wait and see what that looks like. I know it, you know, we don't know the details yet, but we can see what that looks like.
Thank you. So I just want to say thank you again to Julia and Allison for coming and sharing with us all of these details around contact tracing. We will be talking about test and stay next Thursday with Dr. Becca Bell and hopefully Dr. Ben Lee. And I'm not going to take the time right now to explain it in our meeting. I sent out an email yesterday or the day before, I can't remember which, with a letter that explained it pretty thoroughly from what we know right now. So please, if you did not get that letter, please email us and let us know. But otherwise, thank you for being here today. And thank you for all of the things you're doing. We are trying tirelessly to advocate for less work on school nurses. It's a hill I'm willing to die on. We have had way too much on our shoulders, and it's about time that something changes. So thanks for coming, you guys, and we're here for you, and we're right in the trenches with you. So thank you so much, and have a good rest of your week, and plan something fun for you this weekend. Something as little as I'm gonna go garden for 10 minutes or I'm gonna take a bath, something for you.